Hello guys, welcome back. Today let's talk about some nursing management that can go with any pathology, like any disease condition. This nursing management here can go with any disease condition. For example, if you want to write an exam, if you enter the hall and you don't know what to write on nursing management, then you can write these ones. It can go with any pathology. But if you know your nursing management for a specific pathology, then you can write it and add some of these ones. But if you are blank, like you don't know anything to write at all, then you should go for these ones. So for any pathology, number one, your nursing management, if you don't know anything to write, you should write number one, assessment. Because for any pathology, as a nurse, you are supposed to assess the condition. You have to assess. You have to do proper assessment. And then number two, vital signs. Any pathology, normally you must monitor vital signs. You must monitor body temperature, respiratory rate, heart rate. You must monitor oxygen saturation, blood pressure, and so on and so forth. So you must monitor vital signs in any disease condition. And thirdly, we have encourage fluid intake. If somebody is sick, any condition, you must encourage fluid intake to rehydrate the person. Because when somebody is sick, normally the person will lose fluid, either through vomiting, through diarrhea, or even through sweating. The person will lose fluid. So you have to encourage fluid intake. Yes, for hydration, to hydrate the patient and prevent dehydration. And then fourthly, we have encourage rest. In any disease condition, you must encourage rest as a nurse. Encourage a patient to rest. Your rationale is to promote healing. You are encouraging the person to rest in order to promote healing. And then we have reassurance. You have to reassure your patient. Make them to know that their condition is not the end of the world. You have to reassure your patient. And how do you reassure your patient? Through health education. You have to educate the patient. Yes, you have to, for example, if a patient is having something like diabetes, hypertension, and all whatnot, you have to educate the patient about diabetes or hypertension or whatever pathology, any disease condition that the patient is suffering. You have to educate the patient about that condition. Tell the patient everything he or she needs to know about their condition and how to prevent further occurrence or any other thing, or how to manage it at home. You have to educate the patient. And we have encourage proper nutrition. Any disease condition, as a nurse, you have to encourage proper nutrition. Yes, to promote healing. You have to encourage proper nutrition to promote healing. And then we have administer medications as ordered. Normally, you have to administer the patient's medication as ordered by the physician. So you have to administer their medication. For example, if the patient is having pain, you provide analgesic. If it's fever, you administer antipyretic as prescribed. And then lastly, you have documentation, which is very, very important. It's very, very important in the nursing profession. You have to document all what you have done and what you have not done. You have to document. And your rationale here is for continuation of care. Yes, you have to document so that the people you are handing over to, they will be able to know what you have done and know what you have not done, so that they will know where to start from. Yeah, so you must document. You must document. That is extra points. After writing your nursing management, always write documentation at the end. Yeah, so I think this is all for today. We have talked about assessment, vital signs, encourage fluid intake, encourage rest, reassurance, encourage proper nutrition, administer medications as ordered, and documentation lastly. Very, very important. So for this nursing management, like I said earlier, if you enter the hall for an exam and you don't know what to write on nursing management, even if you don't know the pathology, but you see nursing management as part of the question, go ahead to write this nursing management. You have your marks there. Yeah, thank you all for watching, and please, please, please don't forget to like and subscribe for more videos.